So this video is a video that I'm surprised I have to make in today's day and age, but I'm personally not on social media, but people share things with me all the time. And there's a group out there that advocates that we can do dentistry, equine dentistry. I know this is hard to believe, but that it can be done without looking. So in other words, we put the horse, maybe the head is down, and then just working with our hands and not visually looking at the teeth. And while this came about from, you have to understand the history of dentistry in order to understand how this came about. 20, 30 years ago, there was very few people doing the type of work that we're doing now. Actually, nobody was, because we know so much more now than we did back then. We have oral endoscopes. We know a lot more about the anatomy of the teeth. But there were people that were doing dentistry without looking. And that mainly came from floating, taking the sharp edges off of the teeth so that the teeth wouldn't lacerate the cheeks. But today, dentistry has evolved so much more than just taking the sharp points off, that we're checking for periodontal disease, we're checking for open pulps, we're checking for little fractures, we're looking at the color of the teeth even. We're looking for mineralization of the teeth. There's so many things that, you can see in a lot of our videos. We routinely use an oral endoscope. And there's, essentially we're like detectives when we're working on a horse's mouth, because horses, as with all animals, they can't tell us if they're suffering. They can't tell us if there's something painful. And this is where training is really, really important with dentistry, because what good training and a good understanding of dental anatomy and pathology does is it enables us to look for little clues, little details that are significant. And from those details, we can then do more imaging, we can maybe take radiographs, we can monitor, we can basically provide a high level of care. Because they can't tell us, again, where things hurt. The other thing is, we want to catch things early before it becomes a problem. Like we've shown videos of infundibular caries, for example. We can do fillings on all these things. So it's doing a good sedated with a bright light dental exam. And then when we're working, it's very important to be precise. The more surgical we are, the more precise we are with virtually any endeavor in life. This doesn't apply to dentistry. This talk is almost more about life in general than it is dentistry, for the people that have a hard time understanding. For example, every grown adult, for the most part, knows how to write their name on a piece of paper. It's one of the things we've been doing since we're little kids, right? Probably one of the first words we learned how to write was our name. I would challenge anybody to write their name 10 times in a row on a piece of paper, blindfolded, as well as I can by just looking. It really needs no explanation, but there are people that stand firm that they can do just as good a dentistry without looking as the whole rest of us that are trying to advance the industry can by looking. And it's almost insane, but it's a fact. And so I would recommend to horse owners, the mouth is like a hidden cave, right? There's so much that happens in there. There's a whole galaxy within equine dentistry, and it's really important to kind of learn a little bit about it, because you can't see in there. If your farrier comes over and they put 3 shoes on and forget to trim the 4th foot and put a shoe on, you're going to notice and you're going to call them back. But within the mouth, everybody's under the impression that if they're getting their horse's teeth floated, that it's a good job. And that may be so, it may not be so. And the only way you can find out is by educating yourself at least a little bit. And one of the basic parameters is, if somebody is working in the mouth without looking, without being very precise and methodical, just apply the analogy to yourself. Would you want your dentist, no matter how gifted they might be and how experienced, to just work blindfolded on your teeth? No. Well, you'd never want your farrier to work blindfolded. You won't want a surgeon, you won't want a mechanic, you won't want a janitor, you won't want anybody, a landscaper. Nobody wants to work blindfolded. And so it's the same with dentistry. So really evaluate how methodical people are when they're working in your horse's mouth. Are they really evaluating things? Are they taking the time to look? It's at this point, the people that are advocating to work without looking, it's almost, it's a religious belief at this point, and it needs to change because it does no good for the industry. And all it is a small group of cultish people that are refusing to open their eyes, literally. So hopefully we can change that.